Hello, I'm Harry Hobson, President and CEO of Plymouth Harbor.
And I'm Karen Novak, the Administrator for Strategic Health here at Plymouth Harbor as well.
Hi, Karen. And I think as you can see, we've got our guest here today, Jeff Decker, who everyone knows here at Plymouth Harbor. And Jeff is our Director of Safety Services. And we've asked Jeff to join us a little later here in our update and talk to us about safety services here on the Plymouth Harbor campus. But before we get there, Karen, why don't you share with us a COVID update here at Plymouth Harbor? And then I've got some questions and maybe some clarifications related to the CDC that I think people would be interested in. So why don't you go ahead?
It's another great day when we can start off by saying we have no residents that are positive and we have no staff members that are positive for COVID. Currently, we have one of our residents that came from the community that was admitted to the Smith Care Center who is under observation because this person is not fully vaccinated. And according to CDC guidelines, that person has to be in observation for 10 days. So currently, one person in observation.
Outstanding. We're doing a lot of things right around here. And when I say we, certainly referring to our residents and, of course, our team members. So let's just keep it going. You know, as we think of the CDC, I know, Karen, you've been doing a great deal of reading. I've looked at so many videos as recently as even this morning, and I, like so many people, I finished those articles, I finished those videos, and then I'm a little more confused than I was before I started. So while I'm confident that this is going will gain more clarity, maybe even as early as next week with the CDC, I think we should spend some time on this. The question that comes up so often among our residents is, why do we do this, whatever this is? And most of the time, it really refers to mask wearing and social distancing. So, can you give us some content or context here?
Absolutely. The CDC and COVID right now is kind of fluid. They continue to offer us interim guidance based on what they know at any given moment. We know that as time goes by, they continue to learn about the virus. They do that by looking at scientific briefs as well as direct observation. When they identify a process that actually prohibits that transfer of that virus from one person to another, they put those into those interim guidance. And believe it or not, they just came out with another interim guidance on Tuesday that did indeed address masks and social distancing. It doesn't look like we're going to be out of masks anytime soon this year. Again, masks are the number one way to really prevent that transmission from one person to another. Social distance, if at all possible, if you're not wearing a mask, make sure you've got that 6 foot perimeter around you. We at Plymouth Harbor are in a very lucky environment. We're very dedicated to the best outcomes possible. We practice what the CDC actually has as far as guidance and guidelines for us. Now they may change, but that's based on, again, that evidence-based scientific research that they do quite continuously. We know that Plymouth Harbor has a 2% positivity rate, and it's never really gone higher than that since last October. Currently, the positivity rate for Sarasota County is a little bit over 6%. That being said, we feel like with that 2% positivity rate for here at Plymouth Harbor, we can continue to have our gatherings, even though in the published article that just came out on Tuesday, the CDC recommends no gatherings whatsoever because the COVID cases are starting to escalate. But we're going to keep it, within reason. And when I say within reason, it means keeping that social distance of a 6 foot perimeter around you during any kind of gathering. And we actually have identified a number of our places here at Plymouth Harbor that have specific gathering sizes for particular groups. Like in our Mayflower Cafe, we're allowing up to 67 people because 67 people, as you know, dine there every night or pretty much every night. And they've got that 6 foot perimeter around them. So we can adequately and safely house 67 people for a gathering or a meeting. In the bistro, you can do 24. Each area that has the opportunity to house an event or a gathering, we've actually identified, and you'll see those numbers in the splash. The only kicker part is our colony rooms. The colony rooms are a little bit different. Each one of them has a unique size, and we're going to ask you to self-govern that area to determine how many people can actually be in there safely. We're going to ask that you keep that 6 foot perimeter around each person that is indeed there. I think most importantly, though, we need to remember the basics. We want to make sure that you have your mask on. Wear that mask snugly fit to your face. We want to remind you again that 6 foot perimeter, keep it around you, even when you're sitting down in a chair. Make sure you've got that 6 foot distance around you. We want to make sure that, when you're at an event, that you don't have everybody bringing food and maybe just serving themselves. If you're going to do that, please try to have one server or put your food in a little grab and go bag and you can take it with you. Also important is to wash your hands, before you hit those contact areas, such as handrails or maybe doorknobs. Wash your hands or use that alcohol-based disinfectant for your hands before you start eating that food that's in that bag. Again, those are just basic ways to prevent that transmission of that COVID virus.
Karen, I want to build on that just a moment. And so rather than necessarily dictate number of people by area, okay, we're looking at our capacity is being determined by the ability to maintain 6 feet around you. That's the social distancing. So
Right.
as Karen said, we've measured some areas for you. As she said, the Mayflower 67, the Bistro 24, the Cafe and Pilgrim Hall about 22. So that'll give you an idea. And then as you pointed out, the colony rooms, they vary not so much in size as much as layout. So those will be determined purely on the residents' ability to maintain that social distancing. And we're urging people to continue to wear your mask. Now, CDC may come out with some different guidelines next week. If so, we will certainly address that. And also, just as a reminder, and I know people have asked this question, and that is in my apartment, okay, in my apartment, how many people can I have? And again, I think that depends on the size and type of unit you have. Most important thing, Karen continually reminds us, social distancing. So if your apartment can allow 4 people social distancing, try to cap it off at 4. If you have a larger unit and it can do 6 or 8, okay, as long as you're maintaining social distances, that's fine. But very important, when you agree, that can be confining sometimes in the apartments.
Sure. We know these guidelines are going to continue to change as we learn more and more about this virus and even our vaccine and the possibility of getting a booster. The more the CDC learns, the guidelines are definitely going to change. But that's a good thing. That means we're learning more about the virus and the process that the virus actually has.
Also want to mention, as I normally do, you may already have this splash by the time you see this video, or you'll have it shortly after. And Karen, everything Karen has shared with us is in this splash, and particularly a repeat of those guidelines, which we're continuing to follow. So Jeff, welcome again to our video update. Really nice to have you. It's nice to have you, period, as one of our key team members here at Plymouth Harbor. There's no doubt that I think we're over the hump now with spring break. I know we've had more tourists here since last year, sizably, and probably in more recent years. And that was presented some challenges here at Plymouth Harbor. We also saw an uptick in the foot traffic because of the completion of the Mert Trail. That's the walking path, and it does cross in front of Plymouth Harbor. So we thought it's probably a good time to ask Jeff to join us and talk a little bit about safety services here at Plymouth Harbor, and also in particular timing, because Jeff, I believe last week we did have an intruder that came on the campus and was able to penetrate one of our facilities. So let me just turn it over to you at this time.
Yeah, thank you, Harry and Karen. Thanks for allowing me to join the team here. Um, I really want to learn from the experience and the event that took place last week. We did have an intruder enter our facility and make it into the home of one of our residents. Safety services, our primary goal is to make sure that the residents, staff, and guests, that we're all safe here while we're on campus. And learning from the lesson of the intruder, one of the things that I wanted to make sure that we communicated is that it's everyone's responsibility to help protect and keep everyone safe here. The main message I want to convey is if you see something, say something. Don't wait for approval from a supervisor. Call the front desk at 555. The front desk is the heartbeat of the organization. The front desk will immediately dispatch the entire safety team and activate us so that we could protect our residents, staff, and guests. Some of the other things I want everyone to know is that every day we screen all visitors that come into the campus. We have a new screening system called AccuShield. We take the temperature of every visitor, and everyone has to have a colored dot of the day and or a wristband. We're asking all the staff members to place the colored dot on your name tag and or on your collar. A lot of the contractors will have a wristband wearing on their wrist, so you can easily identify. If you cannot easily identify somebody via the dot of the day or the wristband, you're empowered to ask them who they are and what are they doing here. If you don't feel comfortable asking that question to them, call 555 and let one of us ask the question. Again, safety is a responsibility of everybody here at Plymouth Harbor. One of the things I want to also remind the residents, if you're, please lock your front door, lock the door of your vehicles. Do not open the exterior doors for other people that you do not know. You see, if you, I want to also guard against phone calls. If you receive a phone call, please do not give out any of your personal information. Again, if you see something, say something. We're here to help you.
Jeff, thank you very much. And I'm certainly not going to give away all of our secrets. That's the last thing I would do. But we spent a lot of time talking about that this week. And I think I just want the residents or family as team members to know just how secure this campus is. We do have strategically placed infrared lighting. And what that means is that if there is a break in that beam, safety services is notified immediately of that, and then immediately they go out and check out the situation. So we have those strategically placed. We have for some time, and not to mention the number of cameras here on this campus. In fact, our next door neighbor is the Yacht Club in the same situation. So we cross over quite often, and that's been helpful in the past on the far side of the campus. So a lot of things, security beyond what you see on a day-to-day basis here. So, Jeff, it's a pleasure to have you join us today.
Yeah, thank you very much.
Thank you. And Karen, do you have anything else for today?
Well, I just want the residents to know that we stay on top of the CDC, the Department of Emergency Management, the governor, the Department of Health. There's a lot of entities that we kind of listen to and follow their guidance. So know that we're right on top of things. Should you have any questions about any of the guidance measures that you read in the splash, please feel free to give us a call and we'll be glad to help you understand.
Okay. Well, Karen, this is bringing conclusion to this video. So if you'd like to give us your reminder, and I'll look for my mask.
All right. We want to remind you to wash your hands quite frequently during the day. Hit those high contact areas with an antibacterial wipe. And now, most of all, when the CDC says to don your mask, remember this is a safe, easy tool for you to prevent that spread or transmission of the COVID virus. So remember to don your mask.
Okay. Thank you, Karen. Thanks again, Jeff. And that brings conclusion to this update.